that I haven't seen in a while, and I'm looking at all of you guys. I haven't seen some of you in a while, and I just can't believe how different you guys look. You look incredible. How's your summer been?
It's been great.
Staying busy?
Yeah.
Staying active? I have a couple questions for you guys, and I really want you guys to get involved and be real interactive in this. So what my question is that when you had surgery, did you have expectations before you had surgery as to how things would change for you, whether it be good or bad? Yeah, and I know you and I at the same time went through some real tough stuff.
Yeah.
But you made it through. You didn't eat through it. And you've had 2 babies since your surgery.
Yeah.
Anyone else? Don't be shy, guys. Any hurdles? Yes. Any difficult hurdles that you've come across? So how did you deal with it? Yes! I made her take those. That's hard. That's harder than riding a bike 100 miles. I'm telling you. I was like 5 minutes into that one time. Is this ever going to end?
Can I ask you a question? So since you started amping up your exercise from just the walking to everything you're doing now, is it coming, and are you noticing then a change in like the shape of your body too?
You had something to say. I saw your hand up. But did you ever think that you would be that kind of motivation for someone? Someone has to go out and be that pioneer. So here's another question for you guys. What are you able to do now that you couldn't do before? I'll bet you a lot of you have a lot of different things. Simple things, everyday things. That's the one I was looking for. Okay, this one is for you folks who are pre-op and haven't had your surgery yet. We're talking about expectations, okay? What are your expectations for when you have surgery? And that's realistic. That's absolutely realistic. And that's what you have to do, is you have to find, in terms of exercise, something that you like. You know, that's really the big thing, is finding something that you like, that keeps you motivated, keeps you going. It's really about, you know, especially preoperatively, realistic goals, goals that are attainable. And everybody, all of you guys that have said something, you know, you guys that are pre-op, I mean, you're right on the money. It's realistic, it's doable, it's achievable, you know. But the thing to remember with all of that is you don't want it to be this thing that's so huge that you get frustrated. It has to be little bits, baby steps, you know. And like I always told myself, you know what, you didn't put this weight on overnight. It's not, even if I had the surgery, it's,
right.
you know, 150, 160 pounds isn't coming off overnight. I'm not going to wake up thin. I'm not going to wake up healthy yet, you know. So I really applaud you guys for the, you know, the realistic way that you're looking at it. A lot of you talked about, you know, you wanted to, you know, be healthy and stuff, but now I'm going to go to the vanity side here. Did you ever wonder what you would look like? I guess the question is, had you ever been thin before your surgery?
No.
So could you visualize? Did you have any idea what you could even possibly look like after your surgery? Believe it or not, I knew exactly what I would look like. I had gotten thin, and then when I got pregnant with my son, that's when I put on all my weight. So, but I can see myself. Everyone says, I said, I know what I'm going to look like. I'm going to be smaller on top and bigger on the bottom.
Yeah.
That's exactly what happened. Smaller top, bigger bottom. I don't know how small I would get or anything like that, but, you know, when I was thin before, I was, you know, wearing a size, I was 135 pounds, and I'm wearing the same size I'm wearing now. So, you know, I truly think sizes have changed, though. Anybody else kind of able to visualize how you would look or how you thought you would look? Do a paniculectomy, which is all they're doing is removing the loose skin. And then the tummy tuck is where they go in and they bring the muscle together and tighten it. So the other question I have is, so most of you are to the point that you're eating. Some of you are much further out in your eating. How's that going? I always tell everybody my eyes are bigger than my stomach.
Yeah.
I write down everything I eat every day. Do you, too? I write down every meal I have, everything I eat, just because I'm told I have to. But I still do it. And it really, and there's a few people that I see that, you know, just want to kind of have that accountability, and I have them write down what they eat. And amazingly, people are really surprised that they don't eat enough. They're like, I'm looking at their food and I'm going, what? What? There's like hardly any protein in some of their diets. The goal is 12 to 1,400 calories. After your surgery and after, you know, you're on those 2 weeks of clear liquids and then you're on the soft texture, and even before surgery, did you ever think you'd ever be able to eat again like a regular person? So now that you're eating, does it scare you how much you can actually get in now? It could be the consistency of the food, you know, how dense is the food, what is the food that you're eating.
You know, the last time when Dr. Yadegar in July, when he was talking about that, he was talking, I'm sure he was referencing you, Well, because he said, we've got some of our patients who are, power athletes. He said they don't get by on 12 to 1,400 calories a day.
No.
There's no way. So I think if you might have a day where maybe you didn't even realize that you were much more, maybe you exercise, but you also had to go to the mall and you also had to go do this. Maybe you can eat more also because you burned more off.
Salmon.
Salmon.
I had to have salmon. Had to have it. And orange fish. My husband used to try to get me to eat salmon patties. I'm thinking, he goes, when I was pregnant with my son, he said, we have to have some salmon. I'm like, why? He says, it's brain food. Because our parents told us that when we were little. If you eat fish, you get smart. It's brain food. So after my surgery, I went to the store. Oh, gosh, I have to get something to cook for dinner. That looks really good. And I must have eaten salmon for a week every day. I had to have it. So I'm thinking maybe there was some kind of nutritional deficiency I was dealing with at the point in time, and and now I love salmon. I even put my water bottles at night. I put them in the freezer with about this much water in, and then I put water on top of it afterwards, because by the time I bring two this size bottles to work every day, and I drink them. I put chicken actually on top of that. I have chicken. I cut up chicken on top of that and have it like that.
Oh, okay.
With a lemon vinaigrette dressing. It's really good. If you could tell someone one thing about your journey, what would it be? Because every one of you has a journey. Every single one of you in here. Go for it. Okay, one more question, and I know everybody has an answer for this. If you had to do it again, would you?
Yeah.
Would you have done it sooner?
Yeah.
Not at all, or tried something different? Sooner? I think with me, and knowing what I know now, I guess is best. Knowing what I know now, 8.5 years ago, it was, techniques were improved. Would I have done it sooner? I don't think so, because like you said though, I wasn't ready. My mother kept putting it in my head. You gotta do it, you gotta do it. I don't want to talk about it, You would do it again? In a heartbeat? Mary?
Oh, yes, but can I ask, who had buyer's remorse? You had buyer's remorse? So what would you tell people, so pre-op patients, in case they have buyer's remorse too, where did you go from that change of buyer's remorse to, I'm so glad I did it?
How about you guys back there? tonight was really good. It was real good.